we have a lot more in common, and something that really links us what we do professionally, and that we do a lot of mission work. We were just talking before the show, and I didn't know that both of us were actually in Haiti at the same time after the earthquake in 2012. I went there the day after the earthquake. Within 12 hours, I was on the ground and went there 5 times afterwards. You were there in March, I believe, when actually the what you do for a living was needed even more. You know, in the early times it was trauma. They needed surgeons, and so I hopped on a plane before the airport closed and kind of landed there after the airport closed, a little illegally. But we got in, and so Haiti was a unique experience. But tell us about, we went in different directions. I tended to go towards more trauma. You tended to go towards where you can help people holistically more.
Yeah.
Share with us your experiences.
Yeah, we actually, our leader, because we've been planning that trip for months, came to everybody on the team and said, hey, look, you know, this happened, you know, the airport's iffy. We think we can get in, we think we'll get out. You know, what do you want to do? Things have changed quite a bit, and everybody.
Because getting out was a fear. We were unsure you're getting out of the country.
Yeah. It was, but everybody said, thumbs up, we want to go. It was a tremendous experience. You know, we dealt with lots of different things. Psychological trauma was immense. I mean, people didn't.
Underplayed. People.
They didn't even feel like they could sleep because they were worried. With aftershocks, you know, here it comes down again, and you know, over 200,000 people killed in a very short period of time. And even when we were there, when we took one trip into town, we were in Port-au-Prince, and it was devastating. I mean, not to get too gross here, but I mean, you could smell the bodies still caught in collapsed structures. So, you know, we wanted to minister to the person's, you know, spiritual, emotional, and physical needs. I mean, you know, there were people literally dying in these tent encampments because the temperatures were hitting 100 degrees already.
In these plastic tents.
Tents. It was like an oven. You know,
they were cooking.
Yeah.
And so we dealt with it in different ways. I was there amputating as many limbs as I can and sewing horrible lacerations together, and bone is sticking through skin, and people are coming in without their body parts, and it was beyond description, not to gross anybody out, but we were such a physically operating machine that we totally didn't have time to take care of many of the more important things. Not that that wasn't important, but the aftermath, the psychological overlay, and then the fact that, you know, a hypertensive diabetic who hasn't had their medicine forever was realizing medical problems that were out of my league to begin with treating anyway. But the second wave of doctors that came were, in many regards, a much more important group of lifesavers than those of us who patched up holes and took off dead pieces of tissue.
We literally had one room in this alcove where it was basically a pharmacy.
Right.
And so we had medical students helping us dispense meds and all sorts of things.
It's tough. Where else have you been besides Haiti?
Yeah, been to Russia probably 4 or 5 times. Working in orphanage scenarios there. Some hilarious things when I did a medical clinic in an outlying town. And then been to Israel several times and to Cuba several times. So,
yeah, I'd love to go to Cuba and help there. I've been almost to every Caribbean country, not the side where the resorts are on. The northern leeward side is incredible poverty. Helped start a clinic in the Bahamas. I've been to Ecuador 30 times.
Wow.
And I'm working at a hospital in Honduras, and was going there twice a year until COVID kicked in. And where I communicate with my patients through an app called WhatsApp. It's very common in Latin America, not so much here. And talk to my patients regularly on that venue. But mission work is something that helps us complete what we just can't fix in this country, fix within us in this country, because we're so privileged in this country. There are things that we just can't do in this country that we'll never see, that we see overseas, particularly in deformed children and things like that.